welcome to our January meeting. This is a regular monthly convening we have of organizations working in the digital inclusion space. We are a multi-sector collaborative based in San Francisco, which means we work across the sectors of government, nonprofit, private, academic sectors to bring leaders together to work on advancing digital inclusion for older adults and individuals living with a disability. So we've been around since 2015, and our monthly meetings are an opportunity for us to gather our members and other interested partners together to bring to them also information about companies and technology and programs that they may not be aware of. So it's really a kind of opportunity to share information and start conversations potentially around some of the information that they're learning through these convenings. Today we have two great companies that we have come across more recently. One is we have Stefano Selorio, who's with a company called Carevocacy. He's based on the East Coast in Florida, if I'm correct. And then we have Rosita Wong, who is with a company called HealthJay, and she's based down in Palo Alto. And what is kind of, I think, interesting about both these companies is their use of AI in ways that they can address a lot of the barriers that are very familiar to us when it comes to reaching and engaging older adults and individuals with disabilities through technology. And we're looking forward to having their presentations and learning more about what they do and how they do it and what kind of impact they're seeing through that. So Carla, will I kind of pass it back to you, or?
Sure. So each of our presenters will take about 15 minutes or so to talk about what they do. There will be time for questions. You can put them in the chat. That's also a great way to do it, so we can kind of make sure we can see what's coming in and make sure that your questions get answered. We're going to start with Stefano, and so we'll jump on over to you, Stefano. Welcome.
Happy to be here, and also thank you to Andrew and Carla for having me. This is my first time being at this meeting, so I'm really happy and excited to see there's a lot of people working and solving such an important issue, especially for what we do specifically to older adults. As mentioned by Andrew, actually Andrew and I met for the first time at a summit back in last year, actually in Berkeley, California. And I was sharing a little bit about a product we created called Apo AI. And before I go into it, I'll quickly share a little bit about our organization and what we do, and how we started in the first place. It all kind of really began about 6 years ago or so, where my family and I were originally from the Philippines, decided to take care of my grandma, who is living with Alzheimer's. Her name is Phoebe, and she really was the inspiration, or inspiration for everything that my company has been doing really for the past 3 to 4 years. And so I built this company out of actually during 2020, right when the pandemic started, or when Florida considered what the pandemic was during 2020. And then kind of saw the space around aging and technology, and recognized that, as much as I loved our colleagues in the age tech space, I think they were ignoring a really key component when it comes to introducing technology for older adults, which was digital literacy, tech education, and then specifically how we align that and how does that actually relate to improving outcomes for an individual, specific around the social determinants of health or health literacy in general. So I'm really speaking from really the mindset of a current caregiver right now, but then also looking at opportunities in this space as we continue to expand and partner with others. Here's a little brief synopsis of our solutions. We currently have our 3 main interventions, which are private tutoring that's done online. We have our group classes, which I'll talk to you a little bit about. So it may be a little bit similar to what you might be already doing right now. And then last year we launched, as I mentioned before, our AI product, which is just called Apo AI, and I'll go into a little bit of detail about that. But we do cover a variety of things that we actually do and help out other organizations in helping their members, their clients, whatsoever, in being a little bit more tech savvy and seeing many ways we can help with their community. give you guys a little bit of background, here's a quick picture of like the people we've been able to impact. On the top right corner is our group classes, as you can see on the bottom left corner as well too, and then some of our private tutoring learners that we've been able to impact. And then on the top left corner, which I'll talk about again, is our text-based digital literacy coach that's powered by AI. And then here's a quick status of our organization so far. We are covering 30 learning locations across South Florida. We've served over 23,000 patients and members. We primarily work with the Medicare Advantage population. So we have clients with Humana, Conviva, primary care providers, as well as senior living communities. And I would say the proudest moment that I have is that we have a pretty decent social media presence online, and utilizing today's social media like TikTok, Instagram Reels, and stuff like that, and really demonstrating the power of storytelling through our classes, our tutoring, but ultimately showcasing and destroying the negative stigma around older adults and technology. And so our hope is by doing that, by sharing our story and doing our TikToks and stuff like that, but then ultimately making sure that our products and our solutions are really, really addressing those social determinants of health, as well as bridging that digital literacy divide. I wanted to go quickly over like what kind of topics we do cover. Again, these are pretty standard, what you might actually go over with your members as well. But we go from a variety of things, from online safety to telehealth access. All these things are topics. Our actual popular topic right now has been around ChatGPT and AI. We have one of our learners who's around 80 years old who sends me AI generated images that he's made through some of the websites he's explored, which is so cool and interesting because he's been able to take the things that he's imagined in his mind and actually put it onto to actual creation. Another great story of ours is that we had a 92-year-old Holocaust survivor be able to use TikTok and record himself and produce music, and he's a composer, a pianist, and he's able to create content on TikTok and showcase all the fun musical things that he's been able to do. So those are just kind of some of the fun little stories that we've had with the impact that we've made. As I mentioned before, if you're not familiar with the social determinants of health, these are just kind of the topics that engage with helping older adults be healthier by addressing some of these things. And I mentioned before, we're more focused on the digital health literacy side and seeing whether can patients be more educated so that way they can advocate for themselves when it comes to their healthcare. All this would not be possible if it weren't for my incredible team of what we call Carevocacy, but you can call them tech tutors. But basically, I wouldn't be able to do any of this without them. So we cover a very diverse set of populations in Florida. So we have Spanish speakers as well as Haitian Creole. As I said, I owe it to my team to basically be able to do that and impact the people we've been able to impact for these past three to 4 years. And our team, we are a bootstrapped, a non-ventured company. We've been funded through a lot of other organizations as well, but just some of our amazing mentors, board members, as well as other groups of people who've been integral in helping us grow as a group. And then I'll switch to our AI, which I think it's a more exciting topic than anything else. But when I met with Andrew, or the first time we met with Andrew, I was actually pitching this presentation to the conference about leveraging current technology around generative AI and making it more accessible and using it as an opportunity to be able to provide it to older adults as a tool for them to reach out to someone who is very friendly, conversational, and not judge them for asking what we may think are basic questions of technology, but are very important questions for them. And so we created Apo AI. And it's actually the word that my grandma would call me over because she didn't know my name. And when I found out what Apo was, what it meant in the Philippines, it actually means grandchild. So in a way, we've created a grandchild AI for people who can have access to someone that can address and answer those technical questions that they may have. And it is done through a text-based SMS platform, which is basically your messaging app on your phone. And I'll quickly show how you can register for it. I can send the link if anyone's interested. But it's a very simple process to sign up. Once you provide us your phone number and your email address, you'll get a text message from our phone number talking a little bit, walking you through how to do it. And then all the user has to do is just ask questions, be curious, be tech curious, and feel comfortable in being able to do those things. We also have some great pilot partners that we're talking with to distribute this actual application to a lot of their members. So that'll be exciting, something to look forward to for the next year. But as you can see on the right-hand side, just asking questions like how do I take a photo of my iPhone, and it will do a breakdown and give you an easy to understand answer on how to actually do that question. So that's basically what we do and what we've been working on for a while now. I'm sharing this with all of you just to kind of like put it out there. This is not official numbers, but as of right now, it actually is free for you to use. We ask you to break it, use it, ask weird questions, whatever you want to do with it. As I said before, this is a tool that we're planning to use, that we want everybody to use to be able to have access to somebody they can ask questions to. And so we have a free version of it and we have a paid version of it. This paid version, again, numbers vary. And then we also have opportunities down the road as we start to work with other organizations. Here are some of our milestones. I don't know if you want to know about this stuff, but we do have some things that we planned today. I actually had a meeting with a nonprofit this morning that we're going to be distributing Apple AI in over 1,000 members in the course of like 3 months or so. So that'll be really exciting. And all their members that are working with the organization will now have access to Apple AI if they decide to sign up or opt in for that. But it's been a really exciting journey in building something with generative AI, and then also really taking something that has been, I'm sure everybody knows, like the word of AI has been used over time, but taking that and putting it into a specific problem and making it accessible and easy to use is something that we're really excited to be working on for 2024.
I will get started with the first question in terms of this Apple AI is designed particularly for older adults. Is that correct?
So because of our specific group of people that we work with, yes, it's trained on, the model is basically trained as if the person is, even though it knows that we work primarily with older adults, it can help other types of users. So it wouldn't know exactly how old you are, if that makes sense. But it is definitely trained into becoming to be trained to be a tech tutor.
What kinds of questions do you see being asked most regularly as you sort of monitor the use of this app?
Yeah, so that's a great question. So it varies. So we've had a user, for example, they are setting up something, they're not familiar with the actual hardware. And so what they do is while they're setting that computer, smart TV or whatever, they're texting Apple AI at the same time, right? Or they might ask it beforehand and then they already have their instructions listed. Maybe you're a visual learner, so you have all these notes basically in your phone that's stored so you can, look back at it. And then we've also had other people who've used it as more of like a social companionship, right? As a way to have a conversation too. Again, like but we know we've had some learners who are downright really curious, but they text, our support number like at late nights or whatsoever because they're thinking about it, right? For this tool, we've been able to provide something that they can access really 24/7. And so it really depends on what they're trying to learn or what they're trying to access. And because we're in this early stage, I'm really excited to see, what other conversations that comes up from our Apple AI.
So for others on the call today, if you'd like to ask Stefano a question about Apple AI or any of the other kinds of things that Carevocacy is doing, put your hand up and I'll call on you.
How accurate is it? So I know that's a kind of term, accuracy, in terms of how you might define that, but go ahead.
Yeah, and again, I don't know if how familiar everybody is with the term or the term around hallucinations and what how AI works. But I like to say this: it is trained on existing data, up-to-date data. Will it, let's say, try to will it time to time make up something because it wants to give you the best answer it can give you? It happens. That happens with generative AI most of the time. I feel like that's a very human thing too. Anyways, like when you ask somebody like how this thing works, like we try our very best to figure out like to give the best answer, but sometimes it may not always be correct. So I would say it's pretty accurate. Again, when you do have um, the types of members that we work with are very basic learners of technology, and so those questions are pretty common, and so the I would say the answers are pretty accurate in addressing those.
Yeah, Stefano, kind
Yes,
of an
sir.
open question. You have a fantastic program. I have to compliment you on that. You're really thinking ahead. Uh, how do your partners work into this? I notice you have a number of partners that are part of your program. How does that work for you?
Yeah, are you talking about our health plan partners, or you're
Right,
talking about?
exactly.
Oh, okay, okay. Yeah, so great question. So about 2 years ago, Humana slash Conviva, their primary care network, reached out to us because they found us on a TikTok video, and they said, "Hey, we love the energy that you're doing. Could you provide those classes at all these locations that we're working at or that we're providing care for?" And we worked directly with them to design a digital health literacy curriculum that aligns with their initiatives and their goals. So uh, I'll be honest with you, I did not know a thing about any of that stuff. My background's actually in marketing, and I used to work for a scrap metal company before I launched my business. So I had to learn a lot of that process, and what it meant to build patient engagement and education, and especially digital health literacy tools. Um, and then that's where we started to partner up with a lot of those health plans and primary care providers. How do they fit all into this? So I'll share with the fact that the Centers for Medicaid and Medicare Services have enacted a new policy that now mandates all Medicare Advantage plans to provide digital health literacy resources to their members. What does that mean? That's millions of enrollees under Humana, United, whatever Medicare Advantage plan they have, who now have to have access to digital health literacy. That's a big opportunity, not for us, but I'm sure for any organization that works around digital literacy. And so how Apple AI plays into that role is really an affordable option for the plans to use instead of having to hire, um, actual physical people to teach and provide workshops and things like that. Obviously, workshops in person is always the right way to go about, especially when it comes to educating people. But when we're talking about a mandate that was put on the plans literally last year, and now they have to do something, I think ultimately we have the best option to do that. And that's how we're working with them. And as I mentioned before, those are the partners that we're trying to pilot with.
Oh, Richard, I see your hand went up. Jump in.
Thanks, Carla. Stefano, just would like to hear a little bit about how you went about developing the Appo AI. How much effort was that? And just, talk about that process. It's quite impressive sounding. And so I'm just curious to how much effort that went into making that happen.
Yeah. Can I tell you the truth, Richard? It took about a month and a month and a half to get it all together. Like I created the first like MVP product, and then I had a friend who actually is based in San Francisco, who's a software engineer. He took it on, and we worked together in developing it, and we were able to get something like an actual working product within 3 months. Um, I will say that it's I wouldn't say it's complicated. I don't know if I would just say like it, yeah, for the basic way to go about it, Richard, is like you just have to know like which model you're using. So you could use OpenAI's model, you can use any other models. There's a lot of different types of AI models out there, and then the real issue is like how do you have these different models talk to each other, and then what's your distribution for that? So like for us, we chose to do SMS because it was much more easier and accessible versus a web-based platform. And so I would say it took us about 3 to 4 months to put it all together. I don't think it's complicated. I watch a bunch of YouTube videos to put it all together to see if I would figure it out myself. But I think the biggest difference why like our differentiator for why would anyone want to use ours, because like go ahead, you can make your own for sure, Richard. But it's just because we've had so much data and training on the typical model, and we have like the partners that we work with that are excited to use something like this, and I think would be really helpful for other people. But I'm gonna be a sales guy, Richard, and say, why don't you book a tech tutor? And we can have somebody tutor you how to do that. But I'm just kidding. I'm just saying, like, I think it's fairly easy to do it. I think anybody at this point nowadays, if you really look it up on YouTube, anything, you can literally create your own AI assistant or automation out there. So I highly encourage it if you're interested.
Very impressive. Thank you.
Yeah, I appreciate it. Development. I did see a question, Carla, about whether it speaks in other languages. So as I mentioned before, we work primarily with a Spanish and English population. We are trying to see if we can get into Haitian Creole, and our other goals are to put it in Mandarin as well. That might be difficult, but the only languages that we have it available for right now is in English and in Spanish.
Myra is asking if you work with municipal agencies with this digital, like, so would you work with a city agency to deliver this product?
I don't know if there's any municipal organizations here right now, but I'll tell you the truth. They take a very long time to work with. No, it just takes a very long time. And let's be honest with ourselves. Like there's a whole process that goes through working with counties and cities. And if we can't even work with our own county in Broward here, like how am I going to expect to work with the state level, right? So as an entrepreneur, you know, my time as well as our ROI is very on the mind here. And so unfortunately, we don't have any partnerships currently with any municipalities. We did work with the Hawaii State Library System, public library system last year. But in regards to like our other services, not the AI stuff.
Okay.
So yeah, we've had some experience with groups like that, but we went the health plans and healthcare primary care route because again, those are other focuses of authority for the population that we work with.
Great. Well, thank you, Stefano. This has been awesome. But I'd like to turn over the room to Rosita Wong with HealthJay. We're really excited to learn about what she does as well. So welcome, Rosita. You can jump on and share and introduce yourself.
Well, thank you, Carla, and good afternoon, everyone. I am Rosita, based in Palo Alto here in California. HealthJay is a tool that is helping municipalities and different county health departments and community-based organizations to connect to their clients and their constituents. So how do we really connect? There has been so many disconnect. We have seen it in COVID and how the underserved population, the aging, people with disabilities cannot get on with their services. So the number one challenge that we want to overcome and to share with you today is how can we facilitate self-care? How can we put people who are so tech shy and not connected through technology to be able to get on with technology, and therefore you can overcome your staffing shortages. And therefore, at the municipality level, that you can allocate your resources to where the care gaps are. So 3 things that we want to achieve today. Number 1 is to show you how simplicity is the universal language for people who are aging and experiencing disabilities. And number 2 is how can we connect folks to resources? Now, connecting folks to resources must have care access. So do we really have a tool that can connect your patients, your clients to the services available in the community? so care access. Number 3, it's multilingualism, which is really linguistic equity. We have 25 languages in auto translation that can connect people like my mother or some of the people that you work with to services that were not available to them because of language barrier. In the Bay Area, it's about 30% of people are speaking other than English. Nationwide, 13.6% are immigrants that are labeled themselves as no English or a little bit English. So I'm going to deep dive into a more of a dynamic showcase of what we have. And after that, I'm going to share some use cases with you. So I'm going to share my screen here. This is an app that is available in 25 languages. And you will be able to download it by a QR code or a link that we can share with our customer. So now I'm going to share with you our dashboard. You as an organization, as the city of San Francisco, or as a community-based organization, you'll be logging into a dashboard where you can send massive messages. Now you will be texting or sending a protocol message in English. It will then auto-translate into 25 languages. Hi, friends of San Francisco. It is a rainy day. Please take shelter. Now, this message, you can send it to 5 million people. It doesn't matter what language they select. When they sign on to the app, they will select their default language. It could be Spanish, it could be Mandarin, it could be Tagalog, it could be Vietnamese. It will go directly to the language that they select. So I'm going to select, I'm not going to send to 5 million people at the moment. I'm going to send it to Jim. Now, Jim, it's using English. So it's going to send in English. This is the app.
Hi, friends of San Francisco. It is a rainy day. Please take shelter.
Now, I'm going to change this to Spanish. Okay, so let's say I'm going to change this to Spanish. And so we're going to go to, and you can change it as well on the app on the app itself. I'm going to go to Jim. That's a user of the app. These are the languages that we have available. So I'm going to do Spanish. And I will ask Jim this time to perhaps get his flu shot. So, hi, Jim. Flu shots is free. Please get it. Now, this will now be sending to Jim in Spanish. So I'm going to go back to the app and I will refresh my system. Now the app is offered in Spanish. You can see from my little screen here. And I'm going to send this.
Hola, Jim. La vacuna contra la gripe es gratis. Por favor, consíguelo.
Now, the same thing in Mandarin, in Tagalog, in any languages that we offer. There is a health system in Texas that just asked me, do we have Hindi? Well, yeah, we have Hindi. We can add languages that are outside of the 25 per our customer's request. So now this is not only sending messages. We have hospitals who are dealing with undocumented migrant in New York, and they can't have enough people in the front desk to handle the bilingual translation. So guess what we do? We can chat. So let's say I'm going to showcase, let's say Mandarin. Carla and Andrew taught me that you guys, some of our constituents in San Francisco are Asian background. So let's try Mandarin. How do we do it as a help desk to triage people, right? So now we have this in Chinese. So we're going to chat. We're going to chat with this patient. So let's say Jim is at the San Francisco General, for example, and he needed, he had hypertension. He's checked into the ER and he couldn't communicate, for example, at the middle of the night, okay? So now he will take his app and he's going to go to the SF General. The FS General, we're going to have it right here and start chatting with Jim. So Jim, hi, Jim. How can I help you? Now, I'm going to send this. Now, this is sent, again, in English, because I cannot do Spanish. I cannot do Vietnamese. It's sent in English. That means that your staff will always use this tool in English. Yet, when I send this, guess what you see in here? It's in Chinese, if you can see in my screen. So I'm going to reply. But guess what? If my mother could not talk in English and maybe she had poor eyesight, you can actually tap. That's talking in Mandarin. Again, let me show you one more time. Okay, so we are able to now communicate. The first step of care access is communication. Because I know from my personal experience, when I go on a work trip, my mother has diabetes level 2. She never picked up her med. Because when CVS called her, it's always a message in English. She never picked it up, and then she ended up at the ER. So now this is a tool, step 1, is to bring those underserved communities, the aging population who are not tech savvy, do not speak English, to come forward, to be connected through this tool with their caregivers, with the city's help desk, with your CBO services, so they can now receive information as a step 1. Now, step 2, we have survey. I'm sure a lot of you guys, perhaps at the city level, you want to see if people are having a shelter, if people are still homeless, are they needing extra services? So we can send survey. So let me show you in here, in my dashboard here. This survey, it's in a form, and this form can be edited, and you can create a template. So let's say San Francisco Social Determinant of Health Screening, SDOH screening, for example. And you can change the logo into a City of San Francisco logo, okay? I'm going to find a City of San Francisco logo here, which is right here. So the city's logo is here. Do you have a home? Do you have any relapse in the last 2 weeks? So I will make this survey in English, and you can create templates at the city level, at your community-based organization level. You can make it a template, so then you can reuse it. Now, I'm going to send this survey to 1 million people in the city. SDOH survey. I'm going to send this to 1 million of them. Again, this will automatically translate this English survey into 25 languages. That's inclusion. I'm going to send this to Jim, who's using my phone. And I'm going to send this. And this is, now Jim is still in Chinese. So I'm going to send this, and he will receive this in Chinese. If you see this here, 旧金山 survey. So you can start the survey, and the questions are, do you have a home? Okay, yes, I have a home. And then, no, I don't have any relapse. And thank you very much. Now, this data is back to your dashboard. That means your department or your care team can look at the answer immediately. So you can see here, do you have a home? Yes, I have a home. No, I don't have any relapse. This is aggregate, okay? You can also do in-depth care management by looking at every single patient's response. Now, again, I respond in Chinese, but your staff team always have all the data in English, okay? So that's the survey that I wanted to share with you. We have other things that I can share with you quickly is a lot of the counties that we work with. We work with health department, public health department. We have been working with them for behavioral health, SUD, substance use disorder, and even just public health safety net in general, okay? So I'm going to share with you the screen here. I will change this back to English at the moment, so then we all can understand what this is. So I will change Jim back to English. The patient can, or the user can select and change any tiles. So we're talking about aging population. And so, you know, my mother may not like to use the 6 tiles. You can change this to, let's say, you can change this to maybe just 4 tiles. So you can change this to 4. You can downsize it to 2 or just 1 tile. Now let's see what this is. It's City Health. In City Health, what do you see? You can put your departments, or if you are a community health center, you can put your services up and it link to your web pages. So let's say if I want to do behavioral health, if I am not feeling well, Rosita doesn't feel well today, and I want to talk to someone, it goes right to your web page. This is what we call plug and play. Plug and play. So you can plug in anything that you want to share, okay, at no extra cost. It's building like Lego. You build your own app, but it's very easy to use. You can also put your phone number there, and folks can directly call and have direct access, okay? So now this is a display of different departments for the services that you offer. Secondly, we have a bulletin. This is the bulletin, right? Let's see what I have. Look at these. These are it's kind of like a community bulletin board. You can paste any new event. Let's say if you have a mobile clinic coming to the Mission District this weekend, you will be able to post it here, and the customers or the client or the patient, they can book it in real time. They can book in real time, meaning that you no longer need to put a service coordinator in the middle of it to triage. That means you're saving staffing resources and you're facilitating real-time booking, real-time access to social determinant of health. This also displayed in 25 languages, not just in English. Last but not least, I want to show one more, which is you can also have peer support group and their friends, their mentor, their AA sponsor. We do a lot of AA support group. They can all link up and have group chat or video call or support group on virtual. We talked about classes and engagement. Look at what we have here. This is a video library. So San Francisco, City of San Francisco, I know some of your folks are here today. You can have WIC program, managing diabetes, but look at what this is. It's a video. So you can actually educate folks and they can watch the videos and resources. And these resources could be just simple as YouTube, YouTube videos. And you will be building the San Francisco video library on here. So we have been working with home care agencies. We work with Easter Seal for supporting the IDD population for disabilities. We have been working with Front Porch for the Korean-speaking residents. The whole building, 250 of them, they don't even speak English, right? So we work with private sector one-on-one. We also work with municipalities and county health departments. So we work with Palo Alto, we work with, we have been working with the Philadelphia department, in Orlando, in Houston. So we work with these two levels, public health for safety net, as well as value-based care, supporting folks that are underserved. The pricing are different. So when we work with the public health or the countywide or citywide department, it's a 1-year annual base contract, unlimited. So let's say San Francisco, you have 1 million folks, right? Sure. X amount per year, unlimited usage. Just run with it. And we provide all the support. We help to train your CBOs that you identify. Well, we don't really train. We're hoping that we can partner with Carla and Andrew to train to do so. But we can support onboarding the CBOs. Then they all have a mini system to my dashboard. The city will be on top. And so it's a ecosystem, but the pricing are different. When we do private sector, it will be charged per user. So when we work with visiting angels or senior helpers, it's per month. It's under $10 per patient or per user per month. It depends on your scale, but at the county or city level or the statewide level, it will be a one-year contract, unlimited users. Then the cost will be way lower, like way lower.
So just one quick question, and people can put their hands up and ask you. So once, let's say a city does this or a CBO does this, so their clients then need to download this app. Is that what happens once that, once they've agreed to come on board and you reach a contract with them?
Right. So it's a very simple process. We just give you a QR code, and then they will scan it. Then they have the app right there. Or in your website, we create a link where folks can just download it. Now, there's two ways of doing this. When it's public health, then we don't need to collect PHI. We just want my mother and my mother's friends all talking in Mandarin to have access to public information for health and wellness, that you don't need to deal with their personal health information. Then you just give out the app, scan the code, have them go on the app, and they will receive the messages in 25 languages. That is the painless process, fast and quick, and in big volume. Now, if it comes to complex care management, so let's say we are working with a school district, they have families in need, and that will be dealing with their medical information or their case management file, that you will create a profile in the dashboard. So there's two different kind of method of onboarding, but same way. They download the app to their phone, and they carry it with them like a virtual case manager, because this thing talks to my mom 24/7 about her care plan, about her medication, about her diabetes, doctor appointment. It basically talks to her in Mandarin throughout the time. And so it saves resources for your staffing, and she gets better care.
Okay. All right, let's make sure we've got a couple more minutes. If you have a question, put your hand up.
I think there's a lot of people asking, like, do you work with in-home supportive services? And, so I presume you're open to working with any kind of agency or organization, as long as it aligns with their kind of clients and what, but
right.
anything
Yeah, we already did. As I said, we are in Illinois and in Sacramento here in California. They either use our tablet that already have the system installed, and the tablet said you can put it right next to the bed, to their bedside table, and then they can hear all these instructions of how to manage their care throughout the day. We work with people all the way through hospice in 25 languages. or some of the adults that are more independent, like Front Porch. They just download the app to the phone, and then they carry the phone throughout the day. So if the home care aide is 20 minutes late, well, you can text them. You can text them on a walkie-talkie app, and they get it in 25 languages. And it's a secure system. We HIPAA compliant. And we also document all the outreach report. We are tapping into CalAIM. And so we document all the communication in a report so you can go for billing.
But we'd like to thank both Rosita and Stefano for a really interesting conversation today. There's a lot of information to take in, and these tech interventions are innovative, and they're simple, as somebody pointed out, and can be really, really useful. And we just really appreciate this. If you are interested in signing up for the San Francisco Tech Council newsletter, where you can get more information about these kinds of meetings and events that we host, go to our website, www.sftechcouncil.org, and we will put you right on that list. Don't worry, we don't send out stuff all the time, once or twice a month. Thank you for joining us.